Good evening. My name is Elian Ramos, and welcome to a very special Google Hangout. Tonight, we're going to be talking about something that happened last week, but it's something that can potentially impact a lot of our community. And so we want to make sure that everybody has the information that they need so that they can continue having their health insurance. I'm talking about the fact that last week the Federal Health Insurance Marketplace contacted thousands of people requesting additional information. It could be that their applications to the healthcare insurance were incomplete. It could be that they were missing some information, that there were some incongruencies in the information that was submitted. But the fact is that although most people have been able to resolve those little issues, there are a lot of people who have not responded to this request for more information. And that is something that potentially puts them at risk for losing their health insurance. And so to talk about this, this whole situation and how you can prepare yourself and submit everything that you need for to make sure that you continue having health insurance and that you continue staying covered. I have a couple of experts here. We're going to start off with somebody very dear and near to me. She's a repeat guest in this show, and I'm talking about Mayra Álvarez, who is the director of the State Exchange Group for the Centers of Medicare and Medicaid Services at the U.S. Department of Health and Human Services. Mayra, how are you?
Hi, Elian. Thank you.
Thank you for being here. And this is such a important information that the community needs to be aware of. So can we start off by you explaining to us what is the situation? Why are they asking for all this documentation now?
Yes, definitely. So let's provide a little bit of context to the situation that we're talking about. So I think for those of you that are watching and for many of the folks that follow Elian, we know that a lot of us worked hard to make sure that millions of people could get coverage through the health insurance marketplace. And it's because of that coverage that there are millions of people that have access to quality, affordable healthcare services that they need to stay healthy. We know that that marketplace coverage is making a difference in the lives of so many Americans. What we're trying to do now is to keep those people covered while also protecting taxpayers and the integrity of the marketplace. It's why we're focused on making sure that the people we cover are actually eligible. So over the last few months, we've been working very hard to contact consumers in the federally facilitated marketplace whose citizenship or immigration information on their insurance application doesn't match the data we have on file. So these are people that either put in a wrong number or sent in the wrong document. We've been trying to make sure that we can get the right information on file. We've already contacted people about 5 to 7 times on average, and that was either by phone or by mail or by email. And what we've seen is a ton of progress. Over the last few months, hundreds of thousands of people have sent in their documents, and we have allowed us to confirm their eligibility. Let me give you an example. So in May, back a few months ago in May, we had about 970,000 people with citizenship or immigration data matching errors, what other people are also calling inconsistencies. Since that time, we've been able to close about 450,000 of these cases, and we have an additional 210,000 cases in progress. So the people that have responded, that have sent in documents, that have asked questions and gotten answers to their own thoughts about this process, it's made a difference. We've been able to help them confirm their eligibility, and they've been able to keep their coverage. Mm-hmm. What we're talking about today is about 310,000 people that have not submitted any outstanding documents to confirm their citizenship or immigration eligibility. And what we're trying to do is just make sure that they send in those papers so that we can confirm that eligibility and they can stay covered. And I should just flag that for many of these folks, there may not be a problem with their eligibility at all. We just need that documentation to support their application so that we can verify that the information is correct.
Can you explain what do you mean? What do you mean by inconsistencies? Give me some examples here.
Yeah. Well, first, I just want to reemphasize that it's important to know that there may not be a problem with their eligibility. It might be something as simple as they messed up a number on their immigration number or their social security number. It's just that we need that documentation to support their application and verify their information. So what we did is send out the letters to these specific consumers, the specific people that we know need to send in this information, asking them for that missing information. So I think a lot of people, maybe they don't know that they're supposed to send in these documents or they have questions. So that's what we're trying to do through this Google Hangout and other ways. Because the time, the clock is ticking. We sent out notices last week reminding people that if they want to keep that coverage, they actually have to submit the outstanding documents by September 5th. And if they don't, they run the risk of losing that coverage by September or on September 30th.
Wow. So what kind of documents is it that HHS is requesting?
Yeah, so it varies, but it could be, your certificate of naturalization, or it could be, you sending in a federal ID, copy of your federal ID, like your license and something else. What we did with those letters is actually send a list of possible documents that people can send as supporting documentation. But those types of questions are exactly what we want to answer for people so that they don't have to fear why this information is getting asked or worry about having to send it in. It's just to confirm eligibility so that they can stay covered.
And okay, so can you share who are going to be the people most affected by this? Do you have any numbers in terms of how many Latino people may be affected?
Yeah, absolutely. We don't have specific Latino numbers because obviously saying that you're Latino is voluntary and you don't have to report that information. We have a rough estimate of how many people have requested to get the information in Spanish. It's about 20% of the 310,000 or about 58,000 people. But that's people that actually selected the box or checked the box. So it could be more. We could be not really capturing everybody. What we do know is that Texas and Florida are the states with the highest populations of people receiving these notices. And I really want to emphasize, Elian, that we have every reason to believe that the people who applied for coverage through the marketplace, they did it because they believe they are eligible. And we are working this process to confirm that eligibility so that they can stay covered.
Well, and obviously you have to make sure that that whoever is saying that they are who they are, that they are really that person, right? I mean,
exactly.
Yeah, and I think it's something understandable given that this is something that that is so important in somebody's life, right?
Right.
So are you working through all these issues? How many people have lost their coverage so far, or how many people have been affected?
Yeah, it's a great point. So like I said earlier, we've really been able to work through hundreds of thousands of cases so that people can keep their coverage. And it's real progress because people have responded, they've sent in that documentation, and they don't have anything to worry about. They can keep their coverage, keep paying their premiums, and get those services. To date, no one has lost coverage because of a citizenship or immigration inconsistency, and we want to keep it that way. It's why we're sending, or why we sent those letters, so that people could verify their information and make sure they keep their coverage. The goal has not changed. We really want to keep the people that are eligible enrolled in their coverage, as many as possible. Keep them enrolled in that coverage so that they can lead healthier lives, knowing that they can go to the doctor, or if an emergency comes up, they're taken care of, or if they get sick, that they can get the treatment they need to feel better. That security is what we want to continue to offer people, and we just want to make sure that we're verifying that they are indeed eligible.
And so what happens if, let's say that somebody is watching this and they feel like this sounds familiar, right?
Yeah.
And that they have already sent these documents. What should they expect? What should they do?
It's a great point. We've heard a lot of frustration from people about the fact that they might have sent a document in already, or that they haven't heard from somebody. And we know that we've got a lot of lessons to learn from the work that we've done and the progress that we're making. What people should know is that if they have received a letter but think that they already submitted those documents, or if they have questions, they can call the call center, the Marketplace call center. That phone number is 1-800-318-2596, and tell the operator or the call service, the customer service representative, that they got this notice. And that customer service representative can then check to see if their documents are in process or answer other questions to them. Obviously, that call is free, and we want to make sure people can call in both English and Spanish, and the capacity to help in additional languages. But the other opportunity is to actually go in person to one of the partners in their community to get that one-on-one help. We found that, especially with the Latino community and other communities that are disproportionately uninsured, that one-on-one help utilizing our community partners was incredibly important, because they have the trust of the community and they give the information that community members need. We're trying to do the same thing with data matching and ensuring that people get their questions answered by the folks that they trust. So we've been working to do just that by linking up with community partners so that they can also share this information.
And where can people turn if they want to get this local help? What can they do?
They can actually go on healthcare.gov and go to local help. It's a website, right, part of healthcare.gov, and they put in their zip code, and up comes community partners within driving distance of their zip code to make that happen.
And I'm showcasing the website, by the way, just so people can see it. So it's localhelp.healthcare.gov.
Exactly.
Okay. And so what happens if someone doesn't reply by the deadline, by the September 5th?
Yeah, that's a great point. So first and foremost, we're trying to, emphasize to people to send this information. Send it in by September 5th so that you don't have to risk losing coverage on September 30th. And if people know they submitted documents and they still get an email or a call from us, it could be that your documents are getting processed, and there's that mix-up, right? So that's understandable. I think people should be patient with that. But if people do not send in the documentation, that last day of coverage is September 30th. What we're trying to do is work with insurance companies or issuers to ensure that these people will be able to enroll in coverage off the marketplace, so that they don't have to avoid any gaps in coverage.
I want to talk a little bit. Let's talk a little bit about the health markets, like in the local areas. And I know that you have a lot of experience working with that, being that you're in charge of such a large amount of the market. Can you tell us a little bit about the kind of support that you're offering in the different markets?
Sure, absolutely. So we should know that right now the conversation we're having is focused on the federally facilitated marketplace. That's those states where the federal government is running the marketplace. But state-based marketplaces, which is part of the work that my team does across the country, are also doing the same thing and are working to resolve these data matching errors. So states like California or Kentucky or Connecticut or even the District of Columbia, they're also identifying opportunities to reach out to these consumers so that they can send in their paperwork and make sure that their eligibility is verified. And I think across the board, all of the states, all of the areas where the federal government is running the marketplace, our goal really is to keep these people covered. And we want to make sure that we do that while protecting the integrity of the marketplace, while protecting taxpayer dollars to confirm that we're supporting people that are indeed eligible. And sometimes it's something as simple as sending in a copy of a document, but we want to make sure that that process is indeed simple, So it's, you can do it at a local community health center or at a local community organization. You can mail them into London, Kentucky. You can log into your account and you can upload the documents if you have a scanner. Many local community organizations have scanners to help this process along for people. And again, people can call the call center. There's a lot of questions. We know that health insurance, for many of the people that are newly enrolled, it's a brand new concept and they have a lot of questions and they're still trying to figure this thing out, and we're here to help. And we want to make sure we can work with them and answer those questions so that they can stay covered come September and they can continue to use that health insurance and stay healthy.
That is the most important part.
Absolutely.
I know that a question like this, that it's not necessarily it's not necessarily part of this, but I want to make sure that that we clarify this part. And I know when we did the Hangout the last time, you talked about the fact that this is not this has nothing to do with anything related to immigration. And I want you to talk about that a little bit, because you understand how that works, and I want to make sure that people don't get confused and don't think that this is a call, for somebody's immigration papers or anything like that.
No.
So can you explain how that works?
Absolutely, and I'm glad you raised that point, because I think that continues to be a concern for many immigrant families, for many Latino families, for many families that are of mixed status, where someone might be undocumented and someone's a citizen or a legal permanent resident. And we're trying to make sure that people in those families know that the family members that are eligible can get the coverage that they need. And in many instances, these people that we're asking for information from could be part of mixed status families. But just because we're asking for information to verify their eligibility has nothing to do with immigration or immigration enforcement. Any of the information submitted for eligibility for marketplace coverage will not be used for immigration enforcement purposes. We've made that clear in our HHS documents and on our website, and so has the Department of Homeland Security. Many families today are mixed status families, and we know that they want to make sure that their children or their wives or their husbands or brothers or sisters get the coverage that they need. And we just want to make sure that the people that are eligible get to keep that coverage. They should not worry that this is going to lead to some sort of immigration enforcement. Not at all. We're very clear that people that are undocumented cannot get coverage through the marketplace, but legal permanent residents are eligible for coverage through the marketplace, as well as a number of other immigration statuses, eligible immigration statuses. That information is also on healthcare.gov or cuidadodesalud.gov if they want that information in Spanish. And even more than that, our call center, our local community partners can help answer those questions and clarify for people who is and is not eligible, so that Latinos, immigrant families, everyone who is eligible has the opportunity to get the health insurance coverage that they need and need to have to be healthy.
Thank you for clarifying that, because I know that that is the most common question that I get online, and especially whenever something like this comes up, is something that concerns our community and other communities too. Immigration is not a Latino issue, but thank you so much for clarifying that. And I want to welcome our other guest. She just joined us. Thank you so much, Sandra, for being here. Welcome to the Hangout.
Thank you, Elian.
And I'm going to jump right on you, because I have poor Mayra has been answering all of my questions. I've been quizzing her. I am so glad that you're here, because a little while ago we were talking about the local markets. You happen to work at one of our most Latino heavy communities, which is the Dallas area in Texas. And can you tell us a little bit about how something like this would affect the Texas, the people who living in your area, and what kind of work you are doing through your organization?
Yes, the way, I mean, it will affect them if they do not act on time. Yes, of course, you've been talking about losing their coverage. One thing that, what we've been seeing here in our area, people walking in our offices, they do not understand the letters they receive, and also they do not understand sometimes the phone calls they get. They do not have a time enough to write down the address if it's a phone call. So they come here, they call us sometimes they come in person, and we help them, giving them the address. Also, if they want to upload their documents, we help them with that. We have a team of navigators that is able to help them with their need. So what we are seeing, even though the letters are in Spanish, they are still worried that they won't do what they need to do in order for them to keep coverage. So it is very important that they look for help, that they look for assistance. Another thing I was thinking about is, and now is during the summer, families, some of them are out of the country, and so this will affect them if when they come back, they need to read their mail and act right away to be sure that they send their documentation on time. Um,
So just for our viewers, and I'm so sorry I didn't say this before, but for our viewers, for some reference, Sandra is the associate project director and a lead navigator in the Community Council of Greater Dallas, and so that gives her a very unique perspective on what our community is going through when it comes to getting enrolled, when the rollout was going out the first time, but also in terms of how this whole situation is impacting them. And I want to continue with you, Sandra, because I want you to tell me about the kind of outreach that you're doing in the community to make sure that people get this information and that they get prepared and that they respond on time.
Yes, we are joining efforts with some other community organizations, and we are planning some events, informational events, to bring awareness to the community about the importance of this issue. We are also printing flyers to do outreach and distribute them in here in our area, in our counties that we are providing our assistance. We are also offering our services on one-on-one, and we also have some navigators at locations, some sites like health clinics, community centers, multipurpose centers, where the community can come and get assistance there. We do have our local phone numbers in those flyers, so they can come and meet in person. For some reason, some of our consumers, they feel a little uncomfortable uploading their documents. They feel comfortable mailing them register mail. So we do give them information on that. We provide the address for them. We make copies for them if they need the copies, and we make them feel comfortable. And we come close to a location where they are, where they live at. So it is very important that they know that we can assist them. And like us, there's many navigators, I'm pretty sure, all over that they might be, I know they're doing the same thing for our community. So they should know that if they go to healthcare.gov, they can get there, they can click in there for local help, and they will be directed in the right direction.
Thank you so much for clarifying that, because it's true. There's thousands and thousands of navigators out there who are making sure that our communities of color get the information that they need so that they can get covered. And they, like Mayra mentioned before, you can find local help if you go to localhelp.healthcare.gov. You can find a listing by states, and you can find a navigator or a community center that is working on healthcare in your own community. So I want to ask, what can somebody who only speaks Spanish do if they receive this letter that is being sent out and they need more information or they don't understand what it means?
Well,
Mayra? Oh, go ahead. Go ahead.
well, like I was saying, if they do receive it in Spanish and they need more assistance, they are welcome to call to the marketplace, Cuidado de Salud, and they will be directed in the right direction. And they can, I mean, if they are local, of course, they can call our number and our community council and get our information where they can find us. So that would be one of the things they can do. Because, like I was saying, even though it's in Spanish, sometimes it's a little. Mm, they might feel a little afraid of what should I do, what should I say, and so we are here to assist them.
Mm-hmm.
Yeah, and
Especially, go
I'm
ahead,
sorry.
Mayra. Sorry.
I think in addition to what Sandra said, definitely they can call the call center and speak to someone in Spanish. We've been able to add additional Spanish-speaking representatives to the call center to be responsive to people that are more comfortable speaking Spanish. But I really want to emphasize, we're so grateful for organizations like where Sandra works, because they know the community. That's where the community is going to go most likely to answer these questions, whether they speak Spanish or they speak Vietnamese or they speak Korean or Arabic. They're going to go to organizations that speak their language and can answer their questions when they get that piece of paper. So I just want to emphasize how important the community organizations are and really extend my heartfelt appreciation for the work that they've been doing and the work that they'll continue to do with us.
They certainly are local heroes, and especially for a community like ours that is not necessarily used to having this kind of system in our countries of origin, or even if you've been in the country for a while, you may live in your community and not have that kind of interaction with the healthcare system to begin with. So it's very important to reach out to organizations like this, but also talk to other people, and if you're watching this, you're most likely very web savvy, and so I urge you to also talk to people who may not know or may not use the internet, and give them this information. This is very important, especially because the deadline is coming up. It's in a couple of weeks, so you have to make sure that everybody that that may not be watching this show right now, that they get that information. Speaking of which, Mayra and Sandra, can you tell me what is the call to action that you want to leave people in the Hangout? What is the most important thing they should do right now?
So I think I can go first, is really make sure that they are sending the documents that they're getting requested to send. And they can do that a number of ways. They can log on to healthcare.gov and upload the documents themselves for folks that are more web savvy and know how to do that process. Or they can mail their documents in traditional mail to the address that's on the letter. It's in London, Kentucky, and it's important that they remember that when they mail in their documents or they upload their documents, they also send that page that has the barcode at the end of the notice. That barcode helps the marketplace match their documents to the correct application. And again, they can also do this in person with many of our local community partners. That's the real call to action, is make sure you send in the proper documents so that we can verify your eligibility and you can stay covered.
Mm-hmm. Is there a way to do it online too? I'm sorry, Sandra. You wanted to add something to it?
Yes, I just wanted to add that if for any reason the consumer lost their barcode, it is very important that they add the application ID number to the pages that they're sending, and because the marketplace they do receive if they receive information or documents that do not have the barcode or do not have the application ID number, it's very hard for them to match, and it takes longer. It may be impossible. So just
Mm-hmm.
be sure that if they don't have the barcode page, write down the application ID number
Mm-hmm.
on
Mm-hmm.
their documents.
Yeah, and in that same vein, what I was asking before, is there a way to do this online for people who don't want to mail it? You know, a lot of people don't use regular mail anymore. We urge you to use it because we wanted to continue working, right? But for those of you who like to do things online, like I do, where do we go to do that?
You can go to healthcare.gov. They can go to their application there, logging in with their same login information, and they can upload their documents. Yep. It's a much quicker way to do it. Absolutely.
Awesome. And then remembering to put in their number, right? The application number.
Yes, and it is also very important to keep upload a few documents at a time. If they have many documents, they might have a problem. But I think I heard that it's like 10 megabytes that they're able to upload it once. So very important. If they have many documents, do a few pages at a time.
Mm-hmm, mm-hmm.
And they can upload that same barcode page, Elian.
Oh, they can scan it and upload it as well. Awesome.
Exactly.
That is awesome. So with that, I want to make sure that everybody remembers everything that we have talked about today. This is very important information. The deadline is coming right up. It's on September the 5th. And if you don't, if you ignore the letter, if you're like, no, I'm going to put it away and I'm not going to pay attention to it right now, you are at risk of losing your coverage. And remember how important this is for everyone. And after all, like our grandmothers used to say, sin salud no hay nada. Without your health, there is nothing. So just keep that in mind. I'm going to be listing all of this on my blog. There is also a blog that I posted today on the Huffington Post, and you're going to see the link on the screen. Is now rotating, I hope. And if not, the link is bit.ly/stay covered. You're going to find steps that you need to take in order to submit all of these documents, where to find more information, where to link up to all of these different resources that healthcare.gov offers for you, the Department of Health and Human Services. I'm going to thank my guest tonight. Thank you so much, Mayra Álvarez, for being here and for giving us all this precious information. Thank you, because we care so much about our family's health, and we want to make sure that everybody stays covered, right? Thank you so much, Mayra.
Thank you, Elian, for hosting this important conversation.
And thank you so much to Sandra. Sandra, you came in late, but you made it, and we are so grateful that you did. Thank you for all the work that you do in the community in Dallas, and to all the people like her who do so much for our communities every day to make sure our communities are covered. And thanks to all of you who are watching. Please find the information at healthcare.gov. And I'm going to see you next time on the Hangout. You're going to be able to see this on my YouTube channel, which is youtube.com/user/Elian Ramos. And thank you so much for being here tonight. I see you next time.
Thank you, Elian.
You.
Thanks.
Good night.
Good night.
Good night.